Welcome. I am Neely Young, Talent Acquisition Manager, and I will be your moderator today for this webinar entitled Tech Pathways at Tufts Medical Center. We will hear from leaders throughout our health system about technician and technologist careers at Tufts. As a reminder, this session is being recorded and will be available on our events page and also on our YouTube channel. It will also be sent to those of us who RSVP'd for this event. There's also closed captioning available. Tufts Medical Center is part of Tufts Medicine and is comprised of hospitals, our home health system, Care at Home, and an integrated network of physicians' offices and specialty practices. We are proud of our relationships as the primary teaching affiliate for Tufts University. We offer the highest level of academic and research medicine that focuses on our community contribution. Importantly, we strive for a diverse and enriched workplace. Today, we're going to hear from leaders in the pharmacy, the New England Eye Center, our laboratories, and radiology services. We also will have our benefits expert, John Petrosino, and then at the end, we will have time for a question and answer session. Please use the Q&A function at the bottom to send us questions that we'll have time to answer at the end of our session. Thanks so much for joining us today, and we will get started with our first presenter, Tom Webb, who's a pharmacy resident.
Thank you, Neely, for the introduction. So today, I really just want to talk about the Pharmacy Technician Development Program, which really just started a few years ago. And it's really exciting to see the personal and professional growth that these technicians have had just over the last couple of years I've been here. But I wanted to start with our vision statement in the Department of Pharmacy, just to help you guys understand what we're all about. So our vision is really to be sought after for our expertise in delivering medication therapy outcomes. So this includes both pharmacists and technicians to be accountable for these outcomes. And our goal is to provide the best possible care for every patient every time. Our pharmacy services really encompass the whole patient journey. So you can start in our inpatient setting, which patients will come to the emergency department, and we have technicians that do med histories. They'll be admitted to the floor, and we have technicians that take care of those patients on the floor and technicians that are really in charge of the distribution process to make sure meds are getting there efficiently and safely. And then we also take care of patients in our infusion centers and our outpatient retail pharmacy, specialty pharmacy, and ambulatory care clinics, where we have pharmacists and technicians working to improve patient care. So I'll start with our specialty pharmacy team. So this specific team is really, these are experts in navigating insurance benefits and coverage. A lot of these specialty pharmacy medications are very expensive medications with very specific requirements. So you'll see they achieved an 88% prior authorization approval rate. And that allows the patient to be able to get the right medication at the right time and make sure it's affordable for them. So you also have our infusion center pharmacy team. So these teams are really responsible for coordinating the staging and compounding medications that are often life-saving for these disease states that our patients have that they come in for infusion. So some of these patients are oncology patients, immunosuppressed patients, and other patients that are really sick that need to come in for medication infusions. Then you have our retail pharmacy teams. So these teams you might think of as a team in a routine, retail pharmacy like a CVS or independent pharmacy in your hometown. But they really have more face-to-face patient interaction. And they're also responsible for getting the medications to the patient on time, compounding medications, and navigating insurance benefits. They also have a meds to beds program where they are actually responsible for delivering medications to patient bedsides before discharge so that those patients are able to go home with their medication, so there's no delay in care there. And then you have your central pharmacy and sterile products team. So we have our team-based pharmacy technicians in central, which are really responsible for distributing medications efficiently and safely so that our nursing colleagues can administer them on time and administer them accurately and appropriately. And our sterile products area technicians, which again are responsible for compounding medications, making sure they're compounded and made in a quality manner and efficiently to make sure these patients are not getting any delays in care. So the goal of our program is really to provide a framework for which technicians understand the skills, steps, and qualifications necessary to advance within the needs of the department. And we have a variety of roles and responsibilities that help technicians grow personally and assume positions that fill their professional aspirations. So for example, if a technician was interested in business, we have business analyst technician positions in our outpatient pharmacies or our ambulatory care clinics. So that's just one example, or maybe we'll provide them with a project that aligns with their interests. Lastly, I just want to go over kind of the career growth that's possible within this development program. So it starts at a technician 1, which is really your entry level technician. The only requirements here are that you're registered with the Board of Pharmacy and that you have an interest in taking care of patients and providing high quality care. To be considered for advancement to Tech 2, you must actively pursue certification, show professionalism, reliability, and achieve proficiency in your core responsibilities. So technician 2, you really just have a basic understanding of your responsibilities. You're consistently coming into work with a professional attitude and you're very accountable. Then to be considered for Tech 3, you must start to identify opportunities for improvement in the work processes and actively contribute to our improvement efforts. And then you must also start to display competencies in participating for training new hires. And then as a technician 3, Neely, if you just go to the next slide, it'll just pop up. Thank you. You're certified with an expertise. So to be considered for a technician 4, you must participate in at least one pharmacy quality improvement effort and act as a preceptor for training new hires, interns, externs, and really giving back skills and knowledge to your technician 2s and 1s. And then finally, our technician 4s, these are technicians that we really look to serve as leaders for our technician program. And they'll lead multiple quality improvement initiatives. They should serve on one pharmacy meeting, counselor committee, and actively participate annually and lead employee engagement activities. So this is really a general overview of our development program. Really exciting program to be a part of and to see people grow personally and professionally throughout the last few years here. And I'd be happy to answer any questions at the end of this slide deck. But for now, I'll pass it off to Michelle Loom, who will present on ophthalmic tech pathways.
Hi, thank you very much. My name is Michelle. I'm also an ophthalmic technician, and I'll be presenting more about the ophthalmic technician pathway. So a vision statement is pretty much thinking ahead for those who can't really see as far as they can. And so we are your eyes. We try to provide the best care and the best assessment of your eyes when it comes to your retina, your cornea, etc. And we do our best to make sure you get the best care. So we have different, as I mentioned, the retina, cornea, glaucoma. We have also the eye center regarding the glasses shop, optometry, refractive, oculoplastic, and any emergencies go to comprehensive ophthalmology. And it's great because we cover every single thing regarding your eye, every diagnosis. And if you come in for an emergency, we're happy to see you in any of the floors here. We have specialists on every floor. And we're based in Boston, Tufts Medical in Boston, and the Bywin building from floors 9 to 11. And so it's very accessible, but we also have satellite locations in Boston, Cambridge, Framingham, Wellesley, Brookline, all over the area. So you have specialists pretty much around the East Coast that are happy to help you. And the technicians are also spread out in these areas as well. There is no I in team. We are a very close-knit, very, we're very big on teamwork. We communicate very well with each other, and we do our best to assess patients and provide the best detail regarding their assessment. And we make sure we have the best information to give our providers so they know how to diagnose them and how to treat them. And we communicate very well. We make sure the tests the correct tests need to be done, the right drops are provided, and we provide the best support we can to the providers to make sure they are giving their best care. And to the next slide, please. We also have another team called the photography team. These technicians are specialized in taking pictures of your eye, whether it's your retina, your cornea, for pictures for glaucoma. You need it, they can do it. So we like to make some jokes, not jokes, but we like to make the patients feel more comfortable by saying, you get to have a photo shoot regarding your eye. They feel more comfortable that way, but the photo team is also very great in taking the best quality photos needed for the providers to see and analyze and diagnose patients when they come in. On to the next slide. So the Ophthalmic Technician Development Program, our goal is to make sure that our technicians are provided with the best knowledge they can to make the patients feel comfortable, and for providers to know that they can trust us and to know that their patients are in the best care. We have provided most of our technicians with the best knowledge we can, so they also understand the diagnosis of our patients to know what photos they need, what to expect when the patients come in. And we push and encourage a lot of our technicians to go further in their certifications, and we encourage them, we cheer them on to go and above and beyond, whether it's certifications, med school, PA school. We support them in every way. But it all starts with usually in the technician part when they come in, and we pretty much start them off from there. And I'd like to go on. Start off with Technician 1. So most of them is entry level. You don't need any certification for this. And we provide the training on the spot in clinic, and they shadow all of our technicians, mostly the lead technician, and see what it's like to see a patient in the eye center. And then after a while, when they get a bit more comfortable, they'll move on to become a Technician 2. These technicians mostly have a certification in a COA certification. They have a better understanding of what to expect when they see a patient in the ophthalmology center. And they provide the best information they can to support the providers and to diagnose. And they have a better comfort, they're more comfortable regarding the diagnoses. Technician 3, they're more advanced. They have an additional certification called the COT or COMT, and they assist providers with patient care regarding their medication, prescriptions. They are comfortable calling the patients regarding their prescriptions and any directions the provider would like to give to the patient. They can relay that information to the patient. They act as a preceptor for training new hires and interns and participates in the peer evaluation and education. We also are part of more of the advanced procedures and testing when it comes to treatment for patients when they come in. On to the lead technician. They serve as leader, trainer, and assist with the skills of development of staff along the management team and process improvements initiatives. And they provide the support needed within the clinics. They make sure the new hires and all the technicians are making sure that we're doing the right thing and making sure they support us if something goes wrong. But like, they're very great. They're very mentally and emotionally supportive of us, and they make sure everything is in line and make sure that we are providing the best care for our patients. We do have two other, like I said, the photography team, the photographer technicians and the lead photographer. The photographers also have certifications in CRAs, OCTC. Those are encouraged, and we help provide the materials needed to get those certifications. And they have a vast knowledge of those photos that they take, and they provide that information. They know exactly what to look for. And when we're training new technicians regarding this, they are very interested. It's very, very cool to see the photos that are taken and start to understand what to look for when taking these photos. And once they have more understanding of that, some of them become a lead photographer. And again, they serve as trainers, and they work alongside the management team for process improvement initiatives. There is a lot of growth in this clinic. I am one of many that started as just a check-in practitioner, front desk practice coordinator, and I went from there to become a technician 1 to technician 2, and it's a very, very supportive group, and it's a great story for me because I've learned a lot from this department, and I encourage anyone to come and learn more regarding the eyes, and we can help you see more, see further, and hopefully encourage them to advance and become more, whether it be technician, PA, ophthalmologist, or going into med school. And I will pass it off to Elaine to present the lab technician pathways. Thank you very much.
Hi, I'm Elaine, and I'm going to talk to you a little. Oops. I'm Elaine. I'm going to talk to you a little bit about the career pathways in the clinical laboratories at Tufts. Medicine is very exciting. There are 70% of all the medical decisions are based on laboratory diagnostics, and 70% of the patient's medical record is composed of laboratory data. We work together with those with the pharmacy. You know, they administer the drugs, we check the levels to make, and we're partners. And just as an example of some of the accomplishments that happen in the laboratory is we've performed over 107,000 COVID tests in 2021. And this uses technicians, technologists. This is a team. The laboratories are a total team. Next slide. We're made up of many different laboratories. As you see in this diagram, we have clinical laboratory support, chemistry, hematology, HLA, micro. Those are our clinical laboratories. That's where those are the labs. We're open 24/7. We're available 365 days a year, providing diagnostic and treatment information for patients. Also the blood bank. Some of our other laboratories are anatomic pathology laboratories, histology, cytology, cytogenetics, our biosuppository, surgical path. They do highly specialized testing, but as you'll see, they also have entry-level technician positions. The primary area that we see for entry-level staff is in phlebotomy and CRA. CRA stands for clinical receiving area. This is where all specimens come in. All specimens for the laboratory come through this department. Their hands are on every one. They're responsible for making sure that samples, that there's no backlog, that everything's sent to the right place, the right lab at the right time. So in this area, we have a clinical lab support career ladder. The entry-level lab support techs are typically, they usually call a lot of college students, and after a year or so, when they become skilled and they learn how to troubleshoot speak to providers, assist with transporting samples to the correct departments. There is a promotion opportunity to lab support tech too. In this area, we can, you can move to Tech 2 with the high school diploma, but typically you're en route or close to your BA or BS degree. From that point, you can be promoted once you get your degree into core lab positions. Phlebotomists, we do prefer they come in with some high school and laboratory experience. There are phlebotomy certification programs at several of the community colleges. We are looking to the future to be able to train on site. And there again, progress to Tech 2 with 2 years of experience, dealing with pediatrics, geriatrics. And at this point, we like to see national certification. These techs also can move into core lab positions. So now we'll move to some of the core lab positions, and I'll explain to you what that means. So as I noted, the core clinical labs that are open 24/7 are hematology, chemistry, micro, HLA, molecular. In these laboratories, I'll talk a little bit about each one. Our chemistry area is newly updated. We do therapeutic drug monitoring, cardiac markers, tumor markers, electrolytes. In hematology, we're measuring things like white counts, differentials. And in microbiology, we're growing organisms, we're testing cultures to see what organism is present. And in the HLA lab, we're doing testing for compatibility for organ transplants. Next slide. So the career ladder in these particular laboratories, is our introductory technician level is a bachelor's degree in a life science, preferably a biology-based life science. So that is an introductory designation. After a year of experience and you're comfortable in the lab, you would go to a clinical lab scientist or Tech 1. The clinical lab scientist is a newer terminology for a Med Tech 1. Our national organizations have sort of changed the terminology on us. For a Tech 1, we require a bachelor's degree in med lab science as an entry, or a promotion from an introductory level with a bachelor's degree in a life science. There are also associate's degree MLT programs at many community colleges. After about 2 years of experience, and again, we would look at your area that you're interested in. There's advanced training in specialty testing. There's projects, there's test development. There's the opportunity to be promoted to a clinical lab Tech 2. And after 4 or 5 years experience, you can get into senior roles, such as supervisor or tech specialist. And it's important to note that we have 2 tracks. Supervisor is for those candidates who really like to lead and lead a team. Tech specialist is for someone who really prefers to lead a process, a specialty like flow cytometry or special coag or special chemistry. So there's some variability in direction of our career ladders. So this just summarizes for the specialist and supervisory roles. This is after about 5 years of experience, and this does require field-specific certification. So a hematology certification, a med tech certification. The American Society of Clinical Pathologists, ASCP, is the organization that certifies med techs. There are routes to be certified when you have a degree in biology and you've started as an introductory. You can actually get certified based on the actual experience of you working in our laboratories. On the anatomic pathology side, there's several different lab aid and technician roles in the various labs. In histology, where they're dealing with staining tissues, we use lab aids to assist the technologists. Cytology, they also have lab technicians, and they have path tech ones. So these are other opportunities for those who are working on their college degrees and looking for something different and unique opportunity. I just want to, before I turn it over, I just want to tell you that I'm excited for opportunities at Tufts, because although it wasn't at Tufts, I actually had the benefit of working through a career opportunity. I started in a laboratory as a college student, as a sophomore in college many years ago. And in my initial job, I passed through a career ladder where I ended up as a laboratory manager about 30 years down the road. So it's possible, it's exciting, and thank you for listening. And now we'll hear from Mike Foley about the radiologic tech pathways.
Thank you, Elaine. I'm Mike Foley, Executive Director of Radiology and Rehab Services, and I'm thrilled to talk about our profession. I like to brag a little bit too. I am a registered licensed technologist in the state of Massachusetts also, so I get to brag a little bit. Radiology, great department to work with. And next slide, please. A little bit of background on radiology, what it takes to make a radiology technologist. Radiology, first of all, is staffed with all registered technologists, no matter what imaging is being done. Radiology technologists are required to complete a college degree program, minimum an associate's degree. Some of the programs are leaning more towards BS degrees, but you can go through an associate degree program and be eligible to take your license. The college programs are very intense. We do a lot of physics training. We do a lot of radiobiology, physics, anatomy and physiology, positioning, ethics, patient care, to name a few. Each student, before they can take their registry, has to complete at least over 1,000 hours of clinical time here at the hospital. So during your college career, in an associate degree program, the first year you'll go to the college 3 days a week and here at the hospital 2 days a week. When you get into your senior year or your second year, you'll be 3 days a week at the hospital, 2 days a week at the college. So this gives a lot of training time with these students, and upon completion, they will be applying and sit for the national registry and then the state licensure. Next slide. What does a radiology technologist do? Well, first of all, one of the unknown factors a lot of people don't know is we probably touch the lives of every patient that comes through the hospital. We do here at Tufts over 200,000 imaging exams a year. Radiologists, technologists are involved with a lot of the patient care when patients are inpatients or outpatients, such as people always think of x-rays just do broken bones, but we certainly go into the operating room, we go bedside and do people in the intensive care unit for chest x-rays or abdominal images. So we're all over the hospital, but providing a great service to the patients. And one of the things that we have to do as registered technologists is that we try to reduce the radiation exposure to patients. So we have to learn on how we can do as little radiation location as possible. So for obviously safety reasons for the patients. Next. So unlike the other modalities you heard from before, we have a lot of different modalities and career paths technologists can take. You could stay in the Rad Tech side of things for many years and be perfectly fine, or you can go on to different modalities such as CT scan. The CT scan is probably one of the areas that has grown in radiology over many years. CT utilizes hundreds of rows of digital detectors moving around the table and creates a cross-sectional image of the body for the patient. Radiology technologists can certify as CT technologists as a post-primary care pathway, completing the requirement of the clinical and didactic training. So this is a pretty solid program that usually takes about 6 to 9 months after you've been a Rad Tech to complete this and then sit for another registry in CT scan. Next. Sorry. We can also do a lot of different things with our images. We can do the clear cut, cross-sectional anatomy images, or we can get into 3D procedures. I just wanted to share a couple of 3D. On the left-hand side is just a straight 2D picture of a patient's chest and abdomen. And then we can get into some rendering, and you can look at the heart, you can look at the vessels. On the right-hand side, you'll see a picture of the aorta coming down, and off to the side, you'll see the 2 kidneys and into the bladder, so we can reconstruct this in different levels and isolate and zoom in all those different areas to give the radiologist visualization of certain areas of concern and diagnose the patients properly. Next. Another form for a radiology technologist to go into a field would be under mammography. Mammography utilizes an X-ray tube and a digital detection, which is with special equipment to compress the breast tissues, allowing better visualization of many structures. Mammography is the gold standard of early detection of breast cancer. Radiology technologists certify as mammographers taking primary pathway, just like they do in CT scan, but this would be good to mammography, and they sit for mammography license. And next slide, please. And not only do they just do mammography, but we can get into close UV procedures. Unfortunately, we know that 1 out of every 8th woman in the United States, unfortunately, comes down with positive mammography results, and they have to go into getting some advanced visualization or even biopsies. Mammography continues to be rapidly growing. The last 10 to 20 years, certainly we've done 3D imaging, but now we're getting into 3D imaging. 3D imaging allows us to see more tissues and more better visualization of any abnormal or negative tissue. Mammography, oops, that's okay. Fast. Anyways, we'll go on. Another pathway for radiology technologists is to get into MRI. MRI uses powerful magnets to align the molecules in the body in a predictable pattern. From there, it utilizes gradients or radio frequencies to produce images. To compare CT and MR, CT is more structure. We'll see more structures, where in MR we'll see more soft tissue and more tissue elements. As you'll see in the middle slide, you actually can see the brain. You can see pretty clearly the tissues of the brain. The slide over, you see again is the knee. In X-ray, we see just very black and white images, but in MRI, we're actually going to see the tendons and the vessels moving into the. Again, we use 2D and 3D resolution for all these images to interpret the images. No radiation in MRI, just big, powerful magnets. If anybody's gone through an MRI, you know that we question you repeatedly to make sure you're safe to move the magnet, make sure there's no metal in your body or metal that you're wearing. So we do go through a lot of precautions. Next. Again, MRI, to show you, not to scare you, but to show you some of the things that can happen in MRI. Clearly down below, you'll see an IV pole that was brought into the room, and it was not an MRI safe IV pole. Thank God there was no patient in the scanner, but that just took that IV pole and put it right up against the magnet. The picture on the right-hand side is someone brought a hospital bed into the MRI room, which was a non-MRI table, and certainly you can see where the table landed up against the magnet. So again, we will screen our patients. We have metal detectors outside our rooms. We scan them, we check them, and make them get changed to their joints. And just MRI safety is the most important thing for the patients, of course. Interventional radiology, again, one more pathway a technologist can take. Interventional radiology is like a surgical OR room. We'll go in. Procedures are performed by radiologists with the assistance of nursing and IR technologists, and utilize live fluoroscopy. Fluoroscopy is basically a motion picture allowing the radiologist to guide the radiologist to go into certain areas that they want to image and see what's going on and even treat the patient. Here are some images that are taken out of IR. These are all vessels, and the patients get injected with contrast, goes through the vessels, and this particular patient had an aneurysm. You can see the before. So that aneurysm is an outpouch of a vessel, that if it bursts, it could be catastrophic for the patient. So the contrast is just sitting there forming like a little balloon. And then afterwards, after we've kind of ablated and embolized that aneurysm, we'll basically shut the blood supply off to the aneurysm. So there's no blood supply to it, and the vessels will recreate themselves and have a clear pathway for contrast and the blood flow to that particular area of the brain. Okay. So what can an X-ray tech do? Many different pathways. They can be a radiology tech, they can go into CT, they can go into mammography, MRI, nuclear medicine, interventional, PET, CT. There is even a radiology assistant program out there. Professional pathways like me, into management, get into applications, a lot of technology, a lot of IT work that goes on in behind all our images. Educators, training the students. We love students. We like to take students on. We try to hire. We have vacancies, and we certainly have a lot of vacancies to do that. Regulatory roles. The Joint Commission does look at radiology very extensively, consulting and sales. The sky's the limit. Great profession, and thank you for listening to me brag a little bit. And I'll turn it over to John Petrosini from Human Resources.
So I'm John. I'm an HR business partner at Tufts Medical Center. And I'm just going to give you a brief overview of the benefits that we offer here. So we have health, dental, and vision. You have a choice between two health plans. We offer a Tufts Health Plan EPO and a Tufts Health Plan PPO. The main difference is the PPO is a tiered plan. You have more choices for providers and no referrals needed for seeing specialists. We also offer two dental plans, Value and Value Plus. They're kind of the same, except the Plus plan gives you a little bit more for major restorative and ortho work if you need that. We also offer a vision plan, which covers the vision exam, frames, and lenses. Next slide, please. So we also offer a couple different benefits like FSA, 403B, and some other short-term disability. So your FSA, pretty standard, set aside up to $2,750 pre-tax for your out-of-pocket healthcare costs. We also offer a dependent care FSA, which you can use for things like nursery, school, daycare, and things for your children. We also offer a 403B, pretty much like a 401k, but because we're a nonprofit. So you can do either Roth or traditional, up to 75% of your pay. And after 1 year of service, up to 1,000 hours worked, the medical center will actually match up to 3% of your contributions. We also offer short-term disability paid through by the hospital as a benefit to all our employees. So we cover up to 60% of your weekly pay if you need to take a short-term disability. Next slide, please. And finally, we also offer some PTO and some voluntary benefits. Starting out, you get 9 paid holidays and 4 weeks of PTO to start, which is pretty generous. We also offer tuition and certificate reimbursement programs alongside a subsidized MBTA or parking expenses, depending on how you need to get to the hospital for your shifts. We also offer some voluntary benefits that are totally up to you to pick. We offer legal plans, pet insurance, home and auto, identity theft, and many others. Next slide. So I'm going to kick it off to a Q&A now. If anybody has any questions, we'd be happy to answer them. Please put them in the chat.
So the first question that we had was, what are the next steps? How do we get in touch with Tufts Medical Center and know what positions are open? So the website is jobs.tuftsmedicalcenter.org. So we invite you to look at all of the open positions there, put in applications of any positions that you're interested in, and our recruiting team will be in touch with you to discuss those open positions. John, can you talk a little bit more? There have been some questions about tuition reimbursement or college discounts and how that actually works.
Yeah, so the tuition reimbursement, everything is prorated to the amount of hours you work. So if you're a full-time employee, you get $4,000 a calendar year. So you can take your relevant courses. It will get approved by your manager once you've worked with the medical center for 6 months. And then you get reimbursed once you complete the course and show a passing grade. So we do also offer some discounts for certain schools. I'm not sure off all of them off the top of my head, but a lot of them offer a 10% tuition discount if you're a medical center employee.
Thanks, John. There's another question about, do the positions indicate entry-level technicians? So the positions will say different departments have different titles, but the job descriptions include the job requirements. So you'll see some of them will be listed as Tech 1. Most positions in the title do not say entry level. They'll just indicate Tech 1 on most of those. Another question is everything in Boston. So the medical center is in Boston, but there are also ambulatory facilities, meaning facilities outside the actual hospital. So there are facilities within the hospital and facilities outside of the hospital, and all the locations will be listed in the job description. And you can also search by location. So in the drop down, when you're looking for keywords, you can enter the location that you're interested in as well. Another question about the contact information, your first line will be to apply and to be in touch with the recruiting team. And then the recruiting team would pass you to the right hiring leader. The representatives here on this panel are not all hiring leaders. And so they would send you to the recruiting team so that we could make sure that you're talking to the right hiring leader for the area that you're interested in. Let's see, I see someone asking about growing from a medical assistant role. That's a great start. We have a wonderful history of career paths from medical assistants moving into technician and technologist roles. So please look at the open positions that we have. And do applicants need healthcare experience? Some do and some do not. The purpose of this webinar is to talk about on-ramps into our technician and technologist roles. And there are a variety of on-ramps. Not all roles require healthcare experience. So please just look at those details in the job descriptions. And also when you're talking to a recruiter, if you've applied to a position that you're interested in multiple positions, you can apply to as many positions as you want, but also you'll find that our recruiters will be able to advise you if you don't think that the position that you're applying to is exactly a perfect fit. I see a question about a research assistant position. We, as an academic medical center, we have a robust research department. And I know that we have a lot of research positions, so please look at those areas. We have them in a variety of areas within the hospital and the health system. I see a question, can older candidates apply? We welcome candidates, as I said, at all levels in your career. Everyone is welcome. Everyone who is interested is welcome to apply. Absolutely. Thanks for that question. If you need, if you have a question that you haven't, if we haven't answered it, you can certainly email me. It's nyoung@Tufts Medical Center. And I'll be happy to direct you to the right place. Some of the questions I'm not totally clear on in the chat.
Nearly asked one question down below. Is a BS in life science required to be a Rad Tech? No. You can do an associate degree program. If you have a bachelor's degree already, you could be able to not have to take a lot of the college courses again, except for health physics and radiation physics. So No, you don't need your BS, but it would help you along in your career path. But I hope that answers your question.
I see a question. Can career changers apply? Absolutely. And I think you'll find also, in addition to some of the entry level roles we have, you may have transferable skills in other areas. So there are multiple entry points onto these career paths. So please, apply to those that you are interested in. We would love to talk to you more about your roles, but we do find great transferable skills. And we're talking today about these roles, about technicians and technologists. But we do have an abundance of non-clinical roles as well throughout the health system. Oh, there's a question. What's my role? I'm a talent acquisition manager, so I lead recruitment at the health system.
Neely, I would, this is Elaine, from the laboratory. And I would say for the person who's really looking for information for STEM follow up on the different careers, I think all of us who spoke today, I believe all of us have national licensure or certification agencies, and they have many, many pages of information. We did a very high overview, and I know any one of us could talk for hours about our careers and what we love about it. But I'd encourage for you to do some basic research on some of those professional affiliations on the web, on the internet.
Thanks, Elaine. There's a question about the typical salary. I would say it varies broadly based on the specialty that you'd be going in. So we talked about everything from imaging to the pharmacy and the lab, the eye center. Of course, we also have a robust rehab program. So John and his team spend a lot of time with market analysis and compensation. And we also focus heavily on total rewards. So that includes some of the things that John talked about. So things beyond salary. However, our salaries are competitive in the market, and we stay very close to that. Mike, do you want to say anything about our rehab group? We didn't talk specifically about that, but do you want to give just a quick high level in the last minute or so?
Sure, Ken. Rehab, when we say rehab, we're referring to physical therapy, occupational therapy, and speech therapy pathology. Certainly the therapist, most therapists come out with a doctorate degree now. They have to have their master's degree. They can focus their practice on either inpatient acute care setting or outpatient diagnosis and treatment settings for all three modalities, actually. The difference between physical therapy and occupational therapy is a common question people have. So physical therapy, obviously, we are strengthening body parts, strengthening areas of injury. Occupational therapy would be more fine-tuning tendons and motion of many different things, whether it's extremity or even walking or spine work. So that's the difference between PTOT and now speech therapy is a totally different therapy, and that looks more of can people swallow properly? Are they able to swallow without causing harm to themselves? There's some therapy treatments that can help people that have had maybe strokes or post-op surgery of the esophagus. So they look more of the swallowing techniques for the patient. And not, by the way, all three modalities not only just do adult, but they do pediatrics too. So great fields, great staff down there, very highly educated, and have a lot of good talent with patients.
Thanks, Mike. Any closing comments, team? Thank you so much for bringing that information to our attendees today. And thank you all so much for attending and your interest in Tufts Medicine and Tufts Medical Center.